Hello and welcome to this semester. This is individual appraisal and assessment for counselors in practice. I think it's a fun class. I enjoy teaching it. I've taught it for a couple years now. And so I think it's going to be a really awesome semester. I'm Dr. Black. I'm a psychologist. I've been a psychologist for several years now. In terms of working with me, if you need to meet after class, we can do that. Or if you need to set up an individual appointment on a different day and time, I'm flexible. Just let me know. Usually meeting in the evenings for me works best. This is our class time. I am on the East Coast, so this class time is set up for you guys where you're at on Pacific time. So we'll just deal with some course time change issues there. If those pop up, we'll work through those. These are the days that we'll be meeting over the course of the semester. So the purpose of this class is to get you guys familiar with using different assessments in therapy, what those assessments look like, how to identify which assessments make the most sense for whatever the patient's or client's presentation is, whatever they have going on. We're going to be looking at psychometrics within that, so reliability, validity, those types of things. So here are the objectives. I've kind of started to cover some of those already. A big thing, as I've kind of already discussed, is identifying, all right, if this person is experiencing anxiety, what types of assessments do I need to use to make sure that I'm helping the client, that we're identifying if this client is improving or not in terms of their anxiety, that type of thing. Knowing how to administer assessments is really important, because if you administer them in a way that's not maybe standardized for some assessments, it could invalidate the testing or the testing results, depending on what assessments you're using. Being able to formulate different types of connections between assessments and kind of synthesizing all of the information down to a summary is really important, to be able to say, all right, well, this test is saying this and this test is saying this, and what are the conflicts that might be occurring between the tests, what are the similarities, and how do we bring all of that together into a summary? And how do we write all of that data and information up in a report in a way that makes sense to other professionals and to the clients themselves if the client requests a copy of that report? Now, part of that is going to depend on who the report is for, right? So if you're in a forensic setting, the report might be maybe for a judge or a court, and that might look differently than if you're just in an individual, say a private practice setting where the client just wants that information for themselves. Versus say if the report is going to someone else within the field, say another psychologist or another counselor or a psychiatrist even. So how you write those reports might be different based on the setting that you're in. So being able to do all of that in an ethical manner is, of course, important for us as counselors, us as mental health professionals. Being able to identify individual differences and cultural factors is obviously very important, because we don't want to use just a cookie cutter approach when we're doing testing. That's not going to be helpful to our clients. So the exit competencies are very similar to kind of what we saw in the objectives in terms of what you should be able to do at the end of this class. You should be able to identify what assessments work best with a certain client or a certain client population, knowing what assessments to pick, being able to integrate all of those different testing results, as we've already talked about, being able to basically say, this testing says this, which is in line with this testing over here, or this testing over here says this, which is in conflict with this testing over here, and how do I explain that conflict if it's occurring? Being able to apply test theory and validity, being able to look at those psychometrics, validity, reliability, basically knowing, is this a good test to use, or is this, basically a horoscope, or, one of those Facebook assessments or quizzes used to be really popular, probably about a decade ago. The ones that were like, what Disney princess are you? Like, is there any psychometrics behind those? Most of those probably not, and we'll talk about those at some point. We've already talked about being able to integrate diversity, inclusion, being socially responsible, looking at and being ethical when we're considering different assessments. All of that is hugely important. And then lastly, we will spend a lot of time identifying and figuring out and looking at how to manage risk when we're doing assessments. And that's going to be looking at How do I know if someone is suicidal? How do I know what to do when they're suicidal? What are the steps that I need to take? How do I identify what their level of risk is? Like, scale of 1 to 10, are they having suicidal thoughts, but there's no action, versus they're imminently suicidal and I need to be taking very serious action to try and prevent a suicide. So there's a lot that goes into managing risk. We'll be spending a lot of time looking at that. This is the textbook that we'll be using for this class. I think it's a really good one. It tends to cover all of the different topics that we'll be covering in class in a very well laid out manner. These are recommended text. So recommended text, as a grad student, I was like, yeah, I don't have time to be reading all the recommended text or the supplemental text. So we'll cover these, maybe not necessarily fully in depth, but these are really good resources and will be very helpful as you do different assignments. These are definitely citations that you should be adding into those assignments and referring to. So good number of resources here to have. So a little bit about me. As I said, I'm Marie. I have been teaching this class for a while now. I really like it. My approach tends to be flexible and to be supportive for you guys. I know that things come up. I know that life happens. And so how do we make sure that we're learning what we need to be learning over the course of the semester, but also having fun and not being miserable doing it? Let's see, what else will I add to that? I've worked in a variety of different contexts and a variety of different settings. And so I like to bring that experience and those examples into the classroom. So what every student really wants to know, what do I have to do to pass this class? So I added in a reflection paper, and I'm always kind of tweaking and working on the syllabus, trying to figure out, looking to improve it, wanting to make sure that you guys get the most out of the class as possible. So I added this reflection paper the last time I taught the class, and students really seemed to like it just because it's more self-reflective. And it highlights, it's an opportunity for you guys to explore and experience what are taking these assessments like. How do I self-reflect? How do I incorporate these assessments into my own personal growth? So you kind of get a taste of what a client might go through if they're taking these assessments for you, in your therapist-client relationship. So the purpose here is not to be this long, drawn-out 10-page paper. It's more so just write a couple pages, look at within these different assessments that you're taking, answer some of these questions, or at least use these questions to kind of populate some self-reflection and some thought around, what are you wanting to gain from this assessment? What are you looking for in terms of results? Are there any themes that are coming up for you? Are there any conflicts within the assessments that you're seeing in terms of the results? How are these assessments highlighting your own personal strengths and areas of growth? So this should be a fun assignment. In terms of if I can say that as a professor that any assignment is fun, I think it's a fun assignment. The assessment scale presentation, this is 20 points. So here you'll select a assessment. I would suggest using an assessment that we're not going to discuss in class. That way you're getting even more exposure to assessments. So find something that's a little bit more niche or a little bit more focused in, say, for example, a presenting concern. So down here, we talk about different presenting concerns. So if there's something that you're really interested in, say I've had students in the past who are really interested in eating disorders, or that are really interested in sports injury and how someone overcomes a sport injury, that type of thing, like the mental health impact of a sport injury. Find something that you're interested in or that you think that you'll be interested in, and go find an assessment about that. We'll be having the librarian come in and show you guys how to look for assessments in the class. And so that will be really helpful as you start to think about this assessment or this assignment and how you want to go about achieving or completing this assignment. Once you've identified what assignment you want to use, come up with a case example. In the last class, students just made up a case example, which is pretty easy to do. Basically, you need to highlight why you picked this assignment or this assessment, and how it might apply to your population of choice. So for example, if you're working with someone who is experienced trauma, you would likely pick some type of PTSD assessment related scale or trauma related scale. So why you pick this scale, why and how that scale applies to whatever the population is that you're interested in, how the scale was designed. So this is looking at how the individual who created this scale came up with it. It also includes the number of items in the scale. Is it a really long scale? Is it, 500 items? Is it a really short scale? There's only 10 items in this assessment. Is it a self-report where people just fill it out themselves? Or does someone else have to administer it to them? Is it computer-based? All of that type of just kind of general information around the assessment to introduce individuals, other classmates to the assessment. So, which is then also kind of getting into implementation. How's it administered? Is it a computer? Does someone else have to administer it? How is it scored? How is it interpreted? When it's a computer-based test, it usually nowadays there's some type of, scoring program that you can type the information into, or if it's computer-based, it's all automatically done, and it will spit out a computer-based generated report, which can be helpful to at least give you kind of a jump-off point. Psychometrics, validity, reliability, all of the things that go into psychometrics, you need to make sure that you're covering that. Strengths and limitations. Almost every test has some type of strength or some type of limitation, whether that be it's language-based, which means that there's a cultural component, right? Because the language that we use is going to be very different than, say, someone in Scandinavia. And so what are the cultural factors that are playing a role there? Limitations in terms of if a test is too short, maybe it's not picking up on everything that it should in terms of the questions that it's asking. If it's too long, that becomes a time issue where maybe individuals aren't going to take as much time or energy or an effort to complete the test, or it does require more time, energy, and effort to complete the test. So those types of things are what you're going to want to be covering there. And then therapy outcomes. So how is this test going to be useful for you in a therapy setting? How is it going to be useful to your client? How will you guys work together, come together to use this assessment in a beneficial way to increase the outcome of therapy? Clinical applications. So this is kind of going back to that population at the beginning. What types of populations is this useful? Is this useful for kind of everybody across the board? Say what's an example? Say a self-confidence assessment where it might be useful for people in general, like where's my self-confidence at? How do I improve my self-confidence? Versus say an anxiety assessment or a depression assessment, which may only be useful for individuals who are experiencing extreme levels of anxiety or depression. And then we always want to be considering cultural considerations. So what type of role does this assessment have in terms of those cultural aspects? And this is not just, oh, it's been translated in several languages, but take the time to look a little bit deeper into this assessment and how that cultural piece is playing out. The integration paper, I've got a separate rubric for that. And so what's in the syllabus here is very limited, because what I've found in the past is I write a bunch of stuff in the syllabus and then I write a bunch of stuff in the rubric, and sometimes those things conflict. And so in order to deconflict, I've kept this very limited, and we'll cover in detail what needs to go into the integration paper in the rubric. The same with the duties manual. We'll cover that in depth here in a minute. So if you need extra time for an assignment, which tends to occur a lot, especially when I teach this class during the summer, just because the summer is so compact and there's a lot happening, just what I've done to make it very easy for you guys and make it very easy for me is you just click this link and a little Google form pops up. You fill out the Google form with the date that you need an assignment to be submitted. As long as it's within 7 days, there aren't any issues, you'll be good to go. When I go through and I grade, I will look at what that form that you submitted and say, oh, okay, as I'm grading, this person asked for 4 days extension. I won't mark them off for late or anything like that. I'll just look for that assignment in 4 days when they said that they would submit it. So you guys don't need to email me unless there are extenuating circumstances, or unless you really feel like you need more than 7 days, then we can discuss this. It is important to note that you cannot take more than, that you cannot ask for an extension for presentations, because those are scheduled and we need to stay on top of the schedule. But within that, right, flexibility caveat, if you really have something going on and you are unable to make it, or you cannot present that day, email me or set up a time where we can have class hours or instructor hours, and we can figure out and work something out. You cannot ask for an extension for your final assignment. And that's because I have to get everything graded, and you guys, for that final assignment, it's a massive paper. So it tends to be, in the past, I've had like 1,000 pages of grading to do. And I have to do all of that grading and get grades submitted to the university within a very timely manner. I think I've got like 2 weeks. So it's a lot of grading to try and get to in a very short time. So if you then ask for an extension, that leaves even less time for me to be able to get assignments graded in a timely manner. So you cannot ask for, well, you can ask and I will say, no, it needs to be done by this amount of time. All right. Let's see, we'll cover some other things and then we'll get to the actual breakdown in terms of schedules and what the class looks like. So Adler is very committed to social justice. It's very important for us as therapists and us as mental health professionals to be paying attention to that, to be making sure that we're advocating, paying attention to social change and social justice issues and those types of things. In line with that, being socially responsible in terms of our practice is also important. I'll let you guys read through some of these things. I don't like to read. I don't like when people read to me, so I won't read to you guys. We, of course, in line with the previous 2 paragraphs that I just discussed, want to make sure that we are being respectful of indigenous lands and indigenous individuals, that we're honoring them, that we're respecting them, that we're celebrating their work and advocating to promote community health and advocating for social justice and change. Zoom, we're using Teams this semester instead of Zoom, so that will be a change. I am not super familiar with Teams, so that'll be fun. Attendance, obviously you need to come to class. I think that goes without being said. If you miss too many classes, you'll end up failing. I have never had an issue with this so far. Students show up to class. Be professional, be respectful of others. Make sure that you're being responsible for the things that you need to be doing. So for example, if you know that you're going to be late on an assignment, make sure that you fill out that little form. If you know that you're going to be late to class, shoot me an email. Just make sure that you're being responsible for the things and being on top of the things that you know you need to be. Make sure that you're participating in a class, that you're asking discussion questions, or that you're contributing to discussion questions, that you're asking other questions to further the conversation, to contribute to the conversation. Don't be distracted doing other things like on your phone or on your computer or on Facebook or whatever, which I think we talk about a little bit later. Let me not jump forward. We'll get to that in a minute. My role and responsibility, I've already kind of talked about some of that, making sure that I'm being supportive to you, making sure that I am being respectful to you guys, that I am to class on time. There have been 1 or 2 instances where I've maybe been late due to traffic or that type of thing getting home. And so I will make sure to just shoot you guys an email to the class, like, hey, I'm a few minutes late, class will be starting 10 minutes later, that type of thing. That hasn't been an issue. That's happened maybe twice. The university does offer accommodations. I've had students in my class with accommodations. It's never been an issue. Just make sure that you, again, take responsibility, do what you need to do in terms of making sure that that's set up, or making sure that that is good to go. Mental health services, here is the resource that's available for you guys if you feel like you need it over the course of the semester. If you need the writing center, please reach out to them. I used the writing center when I was a student and found it very helpful. I think it goes without saying, but we'll discuss it anyways. Make sure that you're being honest, that you have integrity with your assignments, that you're not plagiarizing. Make sure that you add citations where you need to, so that you're not cheating or doing any type of academic misconduct. Okay. Electronics. Oh, here we go. Electronics. So this is funny because it's an online class. So misuse of electronics will be removed, but that's not really a thing because we're not in an actual classroom. We're all online. So just make sure that you're paying attention to the class. Make sure that you're not. And it's really obvious, right? Like I've seen like if I have you guys up on the screen and one of you is like laughing at something, I'm like, all right, well, I have said nothing funny. So clearly you guys aren't laughing at anything that I'm saying. You know, you're clearly distracted or I'm guessing that you're distracted by something else that you're looking at on your screen. So just make sure that you're not misusing your computer while in class, that you're paying attention, that you're contributing, again, that you're being an adult and doing what you need to be doing. Here is the breakdown of grades. Again, that has never been an issue so far in my classes. Students tend to be very on top of their grades, very on top of getting their assignments done. All right, and finally, the schedule in terms of what reading we'll be doing and when stuff is due. So we've got an assignment due at the very beginning of class, week 2, but again, it's a self-reflection. It's that assignment that's not very long. And we'll be spending some time in class going through some different assessments as you guys, complete those. You'll have time to complete those in class. So that shouldn't be an issue. And you can see here that we'll have a separate presentation. The NEO is what you guys will be completing. I believe it's all set up for you guys to complete it in week 1. And so this is really important, not only because you have an entire assignment surrounding the NEO, but because it's an assessment class, personality assessment is a huge aspect of assessments in general. And so your experience and exposure to this is going to be really helpful. One, because it's the NEO testing that the NEO test that you guys will be completing is a gold standard in terms of personality assessments. But also you get, again, exposure to what your clients might go through if they complete an assessment. And so that then again ties into the self-reflection of, do I agree with my results? Do I not agree with my results? How do I feel about my results? All of that type of experience that your clients might go through or experience when they complete assessments. Here we'll be covering psychometrics and understanding raw scores, understanding reliability, validity, all of those types of things. Week 3, you guys will start to do presentations, and I've set it up so that you guys do 2 presentations. So 2 students will present each class for whenever we have presentations set up. We'll cover intakes. And so I don't know if I've said this yet so far, but I really like to include and incorporate role plays. I think that role plays are an excellent way to get experience with a different skill, whatever the skill is that we're going to be looking at. And so we'll be using role plays throughout the semester, not only to do intakes, but to administer assessments, to look at how reports are written, to provide feedback, that type of thing. We'll be looking at assessing for harm. And as I previously mentioned, we'll be covering and spending quite a bit of time in that area. And then that will feed into part 1 of your duties manual. So I've gotten feedback in the class that having the duties manual split up into different portions is extremely helpful. That way you don't have one massive assignment due at the very end of class that you may or may not have procrastinated on, speaking from personal experience as a student. And so, yes, I'm breaking that up. I've gotten feedback has been helpful. So we'll continue to do that. And that will be covering the assessing for harm portion. Then we'll move into ethics and legal concerns that may occur when working with therapy clients and when using assessments, and how to make sure that you're being ethical, that you're doing the things that you need to do in terms of duty to warn, duty to protect, that type of thing. We'll cover some case vignettes there, which will be really helpful. We'll look at multicultural aspects. We'll look at how to write a report, how to provide feedback to someone else in terms of therapy. And then we'll look at several different categories within assessments. So there's mental health assessments, for example, depression, anxiety, those types of things. There's intelligence testing, which is very popular. So for example, ADHD testing, achievement testing. We've already kind of talked about personality assessments, and how the NEO is a very popular assessment. There's, of course, several other very popular assessments, such as the Myers-Briggs. So we'll talk about all of those. That's one of my favorite classes within this semester, because personality is just so fascinating. We'll talk about values, and I think values are very important in terms of the role that they play within our clients and within ourselves. So it's really important to look at what are assessments that you can use with your therapy clients to help them identify what their values are, what their interests are. Are they in a career path that they want to be in, or do they want to be moving into something else? Interpersonal assessments, so these are basically like relationship or couple assessments, attachment-based assessments, those types of things. A lot of you guys tend to really like this class as well. And then we're moving into finals week and finals future trends within assessments. So that is what the syllabus looks like. Let me pop over and share my screen so that we can look at what the NEO rubric will look like. All right, so here we go. Nope, that's not it. All right, so this is the NEO paper rubric. And I would ask you guys to use this outline. And why that's important is because what ends up happening is sometimes students will like move stuff around, and it makes it harder to grade, because I'm basically going through and looking at, okay, did this student address informed consent? Yes. Did the student address mental status exam? Yes. So if you decide to move that and you put that like halfway into the paper, now I'm like, wait, did they completely skip this section? Where is this section? Now I have to like dig through the paper and find it and bounce around your paper as I'm grading to make sure that you covered what you needed to cover. Just use this outline. It's very helpful as I'm going through and grading your papers. So in the first section, you're going to be covering informed consent. You're going to be covering the reason this person is coming to you for therapy, your role play client that we'll have for the semester. And you'll end up writing up the intake that you did in class as part of the role play. So when we do that role play in week 2, I believe it is, you'll then end up writing all of that up as part of this paper. You'll cover a mental status exam, observations that you have of your client, that type of information all goes within this first section. Then you'll move into the actual assessment write-up. And so this is going to be covering not only the NEO paper that you've taken as part of this class, but you're going to choose 2 other assessments. So you'll be writing up 3 assessments total and combining all of those later on in the integration interpretation section. So sometimes students will ask, okay, well, how do I know what assessments to use for assessment 2 and 3? And I tell students 2 different things. So you have a lot of flexibility is the first thing that I'll say. And you can choose one of 2 options. So the first option is you can choose, okay, hey, I know that this assessment, say your therapy client, the person that you've done the role play with, is presenting with anxiety, but you're really interested in eating disorders. You can take the approach of, hey, I know that eating disorders maybe not necessarily is tied to anxiety, but I'm going to pick 2 assessments that are within that area, or one assessment that's within that area and one assessment that's maybe related to the presenting concern of anxiety, because I just want to rule out that eating concerns are an issue, and because that's what I'm really interested in, I want to get more exposure to that type of assessment. Or you can take the other approach, which is, okay, my therapy client, my role play person presented with anxiety, and so I'm going to pick assessments that are maybe more in line with that. So for example, ruling out social anxiety, ruling out OCD, ruling out other factors or sub-factors within anxiety, or areas that are also related to anxiety, or that maybe have a lot of overlap with anxiety. So for example, this person presented with anxiety, so I'm also going to, as I already mentioned, use assessment 2 will be social anxiety to rule that out, and depression to rule that out, because anxiety and depression have a lot of overlap. So you've got two different kind of approaches that you can take there, and you have a lot of flexibility. It's kind of a choose your own path to learning here in terms of what you want to do. You just need to make sure that you have 3 assessments total for this paper. So you're going to discuss the purpose of the assessment, basically explain to me why you chose this assessment, and you can use one of those different approaches that I already talked about. I chose this assessment because I'm really interested in eating disorders, and I wanted to make sure to rule it out for my therapy client and that it's not present or that it's not occurring for them. Or I wanted to choose social anxiety to rule it out and make sure that it's not present for my client in terms of the anxiety symptoms that they're experiencing. Just make sure that you're able to explain within the paper why you chose that assessment. And then you're going to interpret their scores. So for example, this person scored a 20 in anxiety, and that means this, and that is how this is looking for them in terms of their scores, in terms of the assessment interpretation. Then you're going to move into strengths and growth areas, very similar to what you saw in terms of the reflection paper, except for that this is solely focused in on your client. So what are their strengths? What are the testing results say that their strengths are? What are their areas of growth? Or what are some things that they want to be working on in terms of therapy and your work together? That's what you'll be covering here. And then you're going to be moving into integrated interpretation, which is where you're basically taking all of those results from those 3 different assessments, and you're going to be saying, okay, and make sure that you don't just summarize here. This is not a summary. And so what I will see students do is take information from up here and basically summarize it down here. No, what you need to do is tie those 3 different assessments together. So basically say, okay, assessment 1 for the NEO shows, some anxiety symptoms here, which is also in line with this anxiety assessment that I gave over here. So the results are coming together. The results are aligned in terms of those 2 different assessments. And I'm seeing that those assessments are basically saying the same thing. Or this, the NEO says that this person is very calm, they are very relaxed, but that's in conflict with this other assessment, which shows that they actually have high levels of anxiety. So explain how there's a conflict between those different testing results, and explain how the testing results aren't matching up. Hopefully that makes sense in terms of tying the results together and saying this test is in line with this test, or this test conflicts with this testing results. And here's my hypothesis, or here's what I think might be going on based on the testing results, based on my conversation with the client, based on me asking clarifying questions of the client. So don't simply restate the information. You need to tie it all together in a very succinct way, in a very integrated way. And then come up with a treatment plan. Usually you guys will cover different things like mindfulness, maybe a different approach, a therapy approach that you're interested in. So CBT, Adlerian therapy, psychoanalysis, whatever it is, whatever types of techniques that you're going to be using or that you think would be beneficial to this client, tie it in here. And then make sure that you cite your data. So within the assessment write-up, so up here, what you need to do is, as you say, as you write the results or the interpretation. So for example, my client, I'll name my client Bob. Bob's testing results for his NEO showed that he's a very calm person. So in parentheses, I would then say, T-score equals whatever, or NEO testing equals, 85 or whatever it is to show. That's where I'm pulling that information from. So it's kind of like writing a research paper in the sense that you need to cite or you need to show what score you're getting that information from for your interpretation. And then make sure that you add an appendix with the NEO T-scores at the end of your paper. And then add in a little self-reflection basically within your role play and within your write-up of this client. What do you think that you did well? What do you think that you could improve on? What's something that stands out to you? That type of thing. And that's this paper. So it shouldn't be more than 10 pages. Most students are able to write it within 5 to 10. So that I think is realistic in terms of the write-up length there. And then lastly, we have the rubric, the rubric for the duties manual, and this is your big final assignment, broken into 3 different sections. So what you're going to be covering here at the beginning in terms of content is legal and ethical duties. So what is your role for individuals who are suicidal or individuals who are experiencing self-harm? What is your legal duty? What is your ethical duty? Your ethical duty and your legal duty is to protect that individual, or to try and make sure that they are safe, to try and make sure that if they are imminently in danger, that you, call 911, that you get them to the hospital, that type of thing. Ethical considerations are what types of ethical issues are occurring. So informed consent, if you have to, if someone, say, for example, very extreme type of situation, if a client storms out and says, I'm leaving your office and I'm going to go kill myself. Well, now you're put in a situation where you are going to have to break limits of confidentiality and like call the police or call 911 and say, hey, this client just stormed off and left my, here's their name, here's where they maybe said they were going if they shared that information, or here's where they live. So ethics is occurring because you're now breaking that confidentiality in order to try and protect that person's life. And so you really want to be paying attention to, and you need to be discussing those ethical considerations. And because it's the ethics section, you need to cite the ethics code. So whatever ethics code that you are required to abide by. For us, it's the American Psychological Association. For you guys, it might be something different. I know it's something different. You need to make sure that you're actually citing the ethics code that you're using. Then get into the purpose of whatever the paper-based assessment is. It's pretty obvious because it's in the suicide and self-harm section. So the purpose is to prevent suicide, to identify suicidal risks that might be present within the client and within therapy, to help you as the therapist create a treatment plan or create some type of safety plan to identify and help continue to protect this client and keep them safe. Identify any risk factors and protective factors. That's pretty straightforward. And then within this, so let me back up a second. The duties manual, the purpose of this is whenever you guys move out into your practice, whether that's private practice or wherever you're at for your practicum, whatever setting that looks like, that you have this manual that you print it out in a binder or whatever, that you take it with you and that you have it as a resource when you need it. If you're completely blank and you're like, oh, what do I do when someone is suicidal? You can pull out your manual and say, okay, here's an assessment that I can use, or here's the questions that I need to ask. So for the assessment portion specifically, you're going to include a paper-based assessment for this manual, and we'll discuss plenty of different examples for suicide prevention and assessing for suicide. And then you need to include what your verbal, or an example of what your verbal assessment would look like. So for example, a client comes to you and says, or you ask, are you experiencing any thoughts of harming or killing yourself? If the client says yes, what's the next question that you ask? Like, yeah, I've been thinking about killing myself. I just don't know that I can go on, just as an example. And so what would you say next in that situation as the therapist providing care to this person? What types of questions would you ask to know? Are they, have they put some type of action into play so that they're considering, have they already taken action towards ending their life? Like taken something, pills or poison, or went and bought rope, or sharpened a knife, or went and bought bullets for a weapon. You need to identify that. And you need to know that you need to identify those things, or be asking questions about those things. Has this person already written a note to family, et cetera, et cetera, et cetera. So basically this portion is once that person responds, what's the next question that you would ask? What's the next question that you would ask? What are all of the questions that you would need to ask to identify, again, is this person imminently at risk? They have a plan and they're going to implement that plan and they're going to kill themselves this way? Or is it more, I just don't want to get out of bed in the morning and I struggle with thoughts of suicide, but I would never do anything for XYZ reasons. Those are two very different levels of risk. And so you need to be able to identify what those levels are, where your client is at, and knowing what questions to ask is hugely important for that. So I have this broken down by asking questions about suicide, and then I don't require that you guys include a self-harm assessment, paper-based assessment. I just ask that you assess for self-harm within the verbal assessment. So how I usually do this is asking, have you ever engaged in or are you currently engaging in any type of self-harm, cutting yourself, burning yourself, hitting yourself, anything like that? And that gets at that self-harm question. I don't usually give a paper-based assessment to ask about self-harm. So I'm not requiring that you guys do, just include a paper-based assessment for the suicide portion and then verbally ask about the self-harm portion. And then levels of risk, I've kind of already talked about this, but you need to be able to identify, is your client at this level of risk or at this level of risk? Or maybe I should do this. Are they at this level of risk or this level of risk? Two very different levels of risk, right? One is eminently they could go end their life or take action to end their life. And one is, I experienced suicidal thoughts, but I would never take action. Or I experienced suicidal thoughts, but I took action in high school and I haven't taken any action since then, et cetera, et cetera. There's so many variations within levels of risk. And so knowing where they're at is hugely, hugely important. So that's why it's incorporated within this assignment. And then kind of similar to the verbal assessment. Okay, so if someone says that they're suicidal, based on their level of risk, what action are you then going to take? Are you going to create a safety plan with them and then implement that safety plan? Are you going to maybe change the therapy approach or change the techniques that you're using based on what they're telling you? Do they need to be hospitalized because they're imminently suicidal? So do they need more coping strategies, or do they need coping strategies specifically when they're experiencing thoughts of self-harm or thoughts of wanting to end their life? So you need to kind of have and build up that toolbox for when these types of situations happen. What types of interventions will you use with the client? And then once you know how to, or once you've completed the self-harm portion of the duty manual and the suicide assessment or risk assessment portion, then the second two assessments are going to be very similar. You're going to be covering the exact same content. So it's not actually listed here because there's some slight nuances, but when you get to child abuse, you're still going to be covering legal and ethical duties and considerations. Just some things, again, there might be small nuances. So for example, here, I don't ask you guys to specifically assess children because I think that children are very special and you need to often have additional training and additional education if some type of abuse of vulnerable individuals, children specifically, is occurring. So for example, sexual abuse, you need to have additional training to work with kids and be assessing to make sure that you're not asking leading questions, or to make sure that you're not maybe making some type of impression on how you want the child to ask, which would then impact the results of what they're saying. And so I don't ask you guys to specifically verbally assess children, but if you were to be assessing a caregiver, what types of questions would you want to be asking of that caregiver? So for example, what's an example? Do you ever get so angry at the child that you hit them? That's not a good example because that's a closed-ended question like, do you? But you get the idea there. It's more so focused on asking caregivers questions as opposed to asking the child question. But everything else is going to be the same in terms of the purpose of the assessment, in terms of risk factors, in terms of protective factors. Paper-based assessments, sometimes you guys have difficulty actually finding a paper-based assessment, just because a lot of times within this specific category, you have to pay for assessments. Don't pay for an assessment. That's not the purpose, or that's not the point. Try and find a free open source assessment that you can use for the paper-based portion. And then lastly, you're going to be covering the exact same things within other harm, which is elderly abuse. We cover this because we're mandated reporters. So there are some nuances here, again, more so in terms of the legal, depending on the legal like laws, there might not be a legal requirement to make a report to an agency for elderly abuse, but there's still definitely that legal aspect of making a report that you've become aware that elderly abuse is occurring, and we're mandated reporters. So everything else is pretty much going to be the same in terms of your assessment. Again, here you might end up asking, depending on the individual's cognitive functioning, you might end up doing an assessment with the caregiver as opposed to the elderly individual themselves. So that one could go either way. It just depends on that person's cognitive functioning. But everything else is pretty much risk levels, may be slightly different. It might be, kind of moving away from suicide risk in terms of low, moderate, or high risk. It might still be that in some situations, but it could also be, is some type of abuse occurring, yes or no? So that's less definitive in terms of risk levels, but it's something that you want to be paying attention to and considering. And then lastly, making sure that you're following those organizational headers. So again, I mentioned this in the previous section, or in the previous rubric. If you change the order of things and you decide to put risk and protective factors down at the bottom of your paper and discuss interventions first, and if you move things around, it becomes disorganized for me when I'm reading things, because as I'm grading, I'm going through, okay, here's the purpose. Yes, they address the purpose. Here's risk factors. Yes, they address risk factors and protective factors. So if you start to move things around and change the outline, it makes it more difficult and harder for me to complete grading. So please follow this outline. I have students every class ask, okay, do you want things to be super APA? How do you want the formatting to be? I care, like, again, this is a manual that's meant for you guys in terms of what, as you move out into practicum, to be helpful for you. So I care less about the actual formatting. If you want to use Canva and make it flowery and pretty, if you want to use some other formatting, I care about less than the content. The content is what is important to me, making sure that you know how to accurately and correctly assess for these factors, making sure that you know what follow-up questions to use, or what interventions you would need to use, or what you would need to do in these types of situations if someone is suicidal, or if someone is experiencing some type of abuse, children abuse, elderly abuse, etc. I care more about you guys knowing how to handle those situations and showing me within your paper that you know how to handle those situations than I care about, like, hey, I want to put flowers in my manual, like, or I want to make it creative within Canva or any other platform. Like, okay, go for it. Knock yourself out. If that's what makes the assignment more fun for you to complete, then have fun creating it. Make sure that you use citations. You do need to use citations. I think that we've kind of already talked about that in terms of citing the ethics code, citing any additional citations that you use from the syllabus within those recommended texts, or that you get from other areas. And then lastly, this is something that I'm changing and I'm trying out for this semester. I'm always kind of tweaking this assignment to try and get it to its best. I've had students write 30 to 50 pages for this assignment. That's not the purpose. It's not to, write everything about suicide prevention that's out there. That's trying to boil the ocean. Bring it down and try and make it a manageable, like 5 pages per section, I think is maybe a little bit more realistic. And I think you can definitely cover, say, all of this. Well, let me up here. Legal, ethical, all of this can definitely be covered within 5 pages. I think that's very doable. So that is this assignment. This is your big assignment for the semester. And that is everything that is covered in terms of the syllabus and this class as we get started. So let me know if you guys have any questions.